Today we'll talk about infection control in endodontics. Alright, let's talk about the first line of defense in infection control, sterilization and disinfection of our instruments. Remember guys, we're dealing with instruments that are going deep into the tooth, so it's crucial that they're absolutely free of any microbial hitchhikers. Using an autoclave, it uses high-pressure steam at a scorching 121 degrees Celsius for 15 minutes, effectively obliterating any bacteria, viruses, or spores that dare to challenge us. For convenience, disposable instruments just make sense. For certain procedures, using single-use instruments eliminates the risk of cross-contamination altogether. It's like having a brand new, sterile instrument every single time. Handpieces need precise sterilization too. Make sure you're following the manufacturer's instructions for sterilization, as these can vary. We don't want any surprises when we're trying to deliver the best care possible. Keep those instruments in sealed pouches or containers until you're ready to use them. We've prepped our weapons, instruments, and now it's time to set the stage for our endodontic battle against infection rubber dam isolation. Think of the rubber dam as our surgical drape, effectively isolating the tooth we're working on from the rest of the oral cavity. This barrier prevents saliva, bacteria, and those pesky little aerosols from crashing our endodontic party. Saliva, while essential for digestion, is teeming with bacteria. But the rubber dam's benefits go beyond just infection control. It also provides a clear field of vision, improves moisture control, no more struggling with a soggy operative field, and protects our patients from accidentally swallowing or aspirating instruments or irrigants. Safety first, always. Explain it in a way to patients that they understand. It's like putting a protective shield around the tooth to ensure the best possible outcome for their treatment. Proper placement and securing of the rubber dam are crucial. Take your time, use the right clamps and frame, and ensure a snug fit. A well-placed rubber dam is a thing of beauty and the foundation for a successful endodontic procedure. Alright, we've sterilized our instruments. It's time for another layer of protection, disinfecting the operative field. Think of it this way. Even with the rubber dam in place, there might still be some microscopic bad guys lurking on the surface of the tooth or the surrounding dam. Our goal is to eliminate any potential for contamination. Now, when it comes to disinfecting the operative field, we have some powerful allies: chlorhexidine and sodium hypochlorite solutions. These antiseptic solutions are like the superheroes of disinfection, effectively neutralizing a broad spectrum of bacteria and viruses. Chlorhexidine, with its long-lasting antimicrobial action, sodium hypochlorite, on the other hand, is known for its rapid action and ability to dissolve organic matter, making it the ultimate cleaner for our endodontics. Gently swab the tooth surface and the surrounding rubber dam with the chosen disinfectant, ensuring complete coverage. This extra step of disinfecting the operative field adds another layer of protection, minimizing the risk of contamination and ensuring the long-term success of our endodontic treatment. It's all about creating the optimal environment for healing and preventing those pesky post-operative complications. It's time to delve into the heart of the matter, the root canal system itself. Irrigation. Think of irrigation as our internal cleansing system, flushing out debris, bacteria, and any remaining organic matter from the complex network of canals within the tooth. It's like sending in a specialized cleaning crew to ensure every nook and cranny is thoroughly sanitized. And just like we have our go-to instruments, we also have our star players in the irrigation game: sodium hypochlorite, NaOCl, chlorhexidine, CHX, and EDTA. Each of these solutions brings its own unique strengths to the table. Sodium hypochlorite, or NaOCl, is our heavy hitter. This powerful antimicrobial agent not only destroys bacteria, but also dissolves organic tissue, making it incredibly effective at removing the remnants of pulp tissue and other debris. We typically use a 2.5 to 5% NaOCl solution, striking the perfect balance between effectiveness and safety. Chlorhexidine, or CHX, is our reliable sidekick. While not as potent as NaOCl in tissue dissolution, CHX boasts excellent antimicrobial properties and a longer-lasting effect, providing sustained disinfection within the canal system. And then we have EDTA, our specialist for tackling calcifications. This chelating agent softens and removes the smear layer, that stubborn layer of debris that can hinder the penetration of our antimicrobial solutions. By removing the smear layer, EDTA allows NaOCl and CHX to penetrate deeper and work their magic more effectively. The key to successful irrigation is a combination of proper technique and the right solutions. Copious irrigation throughout the procedure is essential. We're aiming for a clean and disinfected canal system, and that requires a consistent and thorough approach to irrigation. We've meticulously cleaned and shaped the root canal system. Sometimes we need to call in reinforcements to maintain the upper hand and ensure long-term success. That's antimicrobial dressings. Think of these dressings as stationed within the canals to prevent bacterial regrowth and maintain a sterile environment between appointments, in cases where multiple appointments are needed. They're like the guardians of our hard-earned cleanliness. One of our most trusted allies in this fight is calcium hydroxide. This alkaline powerhouse, with its high pH, creates an environment that's highly unfavorable for bacterial survival. It's like creating a no-man's land for bacteria, effectively halting their growth and preventing reinfection. Another option is chlorhexidine gel. This viscous formulation provides a sustained release of chlorhexidine, delivering long-lasting antimicrobial action within the canal system. It's like having a slow-release disinfectant that keeps on working long after we've left the operatory. The choice of dressing depends on various factors, including the clinical situation, the patient's individual needs, and the practitioner's preference. Sometimes, a combination of calcium hydroxide and chlorhexidine gel is used to provide a multi-pronged approach to bacterial control. Placing the dressing is just as important as choosing the right one. We want to ensure it's placed carefully within the canals, reaching the apical portion without overfilling. Proper placement ensures optimal contact with the canal walls, maximizing its effectiveness in preventing bacterial regrowth. Remember, antimicrobial dressings are our insurance policy, providing an extra layer of protection and increasing the likelihood of long-term success. They're a testament to our commitment to thoroughness and our dedication to providing the best possible care for our patients. We've meticulously cleaned, shaped, and disinfected the root canal system, even enlisting the help of antimicrobial dressings to maintain our hard-earned sterility. Now, proper sealing of the access cavity comes in. Think of the access cavity as the gateway to the inner sanctum of the tooth, the root canal system. Sealing the access cavity isn't just about filling a hole, it's about creating a barrier, a protective shield that prevents any leakage or microgaps that could compromise the integrity of our endodontic work. Several materials can be used to seal the access cavity, each with its own set of properties and advantages. The key is to choose a material that provides a tight seal, preventing any bacterial ingress while also being biocompatible and durable. The placement of the sealing material is just as crucial as the material itself. We want to ensure a complete and void-free seal, adapting the material to the contours of the access cavity and ensuring no gaps or marginal discrepancies remain. Remember, even the smallest imperfection can become a breeding ground for bacteria. Proper access cavity sealing is our final act of defense, giving our patients the best possible chance for long-term success and a healthy, happy smile. We've covered all the essential protocols for maintaining a sterile field within the tooth, from instrument sterilization to access cavity sealing. But infection control extends beyond just the immediate treatment area. It's about creating a safe environment for both our patients and ourselves. And that means paying close attention to surface disinfection and personal protective equipment, PPE. Think of surface disinfection as our way of neutralizing any potential threats lurking on surfaces we touch throughout the procedure. This includes our dental chairs, countertops, light handles, and even our trusty dental units. Remember, bacteria are masters of disguise and can linger on surfaces for extended periods, just waiting for an opportunity to strike. Our weapon of choice in this battle against surface contaminants? You guessed it, disinfectants. But not just any disinfectant will do. We need hospital-grade disinfectants that are proven effective against a broad spectrum of bacteria and viruses. Look for keywords like broad-spectrum, virucidal, and bactericidal on the labels. The key to effective surface disinfection is consistency. Develop a routine of disinfecting all surfaces before and after each patient, paying particular attention to high-touch areas. And don't forget about those often overlooked spots like computer keyboards, mouse pads, and even our phones. Now let's talk about our personal protective gear, or PPE. This is our armor, our shield against the unseen enemy. Gloves, masks, face shields, and gowns are non-negotiable in the dental operatory, protecting both us and our patients from potential cross-contamination. Gloves act as a barrier between our hands and the patient's mouth, preventing the transmission of microorganisms. Masks protect our respiratory system from aerosols generated during procedures, while face shields provide an extra layer of protection for our eyes and face. And gowns? They protect our clothing from splashes and splatters, keeping our personal attire clean and contaminant-free. Remember, PPE is only effective if used correctly. Always wear gloves when in contact with patients or contaminated surfaces. Change gloves between patients and perform proper hand hygiene before and after gloving. Masks should cover both your nose and mouth, and face shields should fit snugly over your face. Congratulations! We've successfully navigated the ins and outs of infection control during endodontic treatment. We've sterilized, disinfected, isolated, irrigated, and sealed, all while protecting ourselves and our patients. But our job isn't done yet. To truly declare victory in the battle against infection, we need to ensure long-term success, and that means focusing on post-operative infection prevention. The star of the show in this final act is the coronal restoration, the filling or crown that seals the access cavity we so meticulously prepared. Think of it as the final piece of the puzzle, the protective cap that prevents bacteria from sneaking back into the tooth and undoing all our hard work. The quality of the coronal restoration is paramount. A poorly placed or leaky restoration is like leaving a window open in our fortress, inviting bacteria to waltz right back in. We need a restoration that's not only aesthetically pleasing, but also durable, well-sealed, and resistant to leakage. The timing of the coronal restoration is equally important. Ideally, we want to place a permanent restoration as soon as possible after completing the endodontic treatment. Delaying the restoration leaves the tooth vulnerable to bacterial invasion, increasing the risk of reinfection and treatment failure. But our role in post-operative infection prevention extends beyond just the restoration. Patient education is key. We need to empower our patients to be active participants in their oral health journey, providing them with clear instructions on post-operative care. This includes emphasizing the importance of good oral hygiene, including brushing, flossing, and regular dental checkups. We also need to educate them on potential signs and symptoms of infection, such as pain, swelling, or discharge, encouraging them to contact us immediately if any of these occur. That's a wrap on infection control in endodontics. Remember, maintaining a sterile and disinfected environment is not just a box to tick. It's the foundation upon which successful endodontic treatment is built. By adhering to strict protocols, from sterilizing our instruments and using rubber dam isolation to proper irrigation techniques and the use of antimicrobial dressings, we significantly reduce the risk of infection, ensuring the best possible outcomes for our patients. And let's not forget about protecting ourselves with proper surface disinfection and PPE. So let's all commit to making infection control an integral part of our daily practice, because when it comes to endodontics, a sterile field equals a successful outcome. Until next time, keep those canals clean.